Local programming on KRWG Public Media made possible in part by viewers like you. Thank you.
Thank you for joining us for Fronteras, A Changing America. I'm Casey Counts. The New Mexico Aging and Long-Term Services Department says the new long-term care division will provide more access to support for seniors, individuals with disabilities, and their caregivers. Joining us for a conversation about this new department and the programs it will oversee is Aging and Long-Term Services Department Cabinet Secretary Emily Kaltenbach. Emily, thank you so much for taking the time to be with us.
Casey, thank you for the invitation.
I want to start by asking you about how this new division came to be and what was the need for it?
Well, this was a division that existed decades ago. The department used to oversee the Medicaid long-term care services, MEBIA, and home and community-based waiver services for adults with disabilities and older adults. Those programs moved over to the HCA, the new healthcare authority, many years ago, and this department, our division, has been dormant. And so we've worked on opening it back up again because we know that there are growing needs for all of our older adults and adults living with disabilities to be able to better access long-term care services. And so now we have a new division focused on, as you mentioned, the long-term care needs of our older adults and their caregivers.
Let's talk a little bit about the investment that the legislature made in order to make this happen. What was necessary from the legislative point of view in order to make this a reality?
Yeah, well, we have the legislature to thank for giving us these funds to be able to stand up this division again. And so over the last legislative session, we were allocated some funding to be able to bring on our leadership team and our staffing for that division. And so I would just like to note that this division has some new programs, but also it streamlines programs that we have already been operating, but not in a coordinated way. So we're bringing together a variety of different services and programs under one roof and be able to streamline those. So we're really grateful for the support from the legislature.
I'd like to talk a little bit about the variety of programs that this division will support. Let's begin with New Mexicare. Tell us who qualifies for that and what its purpose is.
It's a really, really important program. It's been a governor's priority. We know that there are so many informal caregivers across the state of New Mexico who are currently caring for our older adults and adults living with disabilities, but they don't get the support, the training, the financial assistance they need. And so we know that caregivers have emotional strains, they have physical strains, there's missed work. And so New Mexicare was stood up to address those issues. This is a program that pays caregivers, informal caregivers, up to $1,400 a month.
And so how does someone know if they can qualify for that?
Well, you can go to our website, NM Aging, and there you can find the qualifications. This program is really for those individuals who are over the income eligibility for the Medicaid home and community-based waiver services, but still have great need and financial need. And so you have to be 60 years or older and meet certain financial eligibility. But we have those. New Mexicare is available across New Mexico. We are about to launch in Bernalillo and Doña Ana counties. So those are two counties that still are to come online.
All right, I see. And why don't you tell us about what you know about some of the financial difficulties that families face?
Well, we know that we have a growing older population in New Mexico. So demographics are shifting rapidly. People are living longer, especially in our rural areas, but a lot of family members have moved away. And so we don't have those natural supports all the time to keep people in their home and community living with independence and dignity. And so we are here as an agency to really help wrap ourselves around those individuals who want to remain in their home and community and live with dignity and live with independence for as long as they possibly can in a safe environment. And so we're seeing that all across New Mexico.
Let's talk a little bit about how the division carves out care, especially for New Mexico veterans.
Yes. So also very important group of individuals who've served our country, our veterans who have a lot of chronic disease, have great needs as they get older. And so we have a self-directed care program in the new division. This is a program that has been operating for many years. It's fabulous in that veterans can decide what services and supports they need. And that's what we mean by self-directed. And that means they can remain in their home and community. And so we work closely with our partners across the state to be able to provide those types of services.
And I'd like to touch specifically on those living with Alzheimer's or dementia and those caring for them. Obviously also a growing problem, perhaps just by the nature of people living longer. Tell me about the challenges that exist and how the division is ramping up support for those folks.
Yeah, it's an understatement. The challenges exist. I think you're absolutely right, Casey, about just the number of our loved ones who will be facing some sort of dementia, whether that's from Alzheimer's or other brain diseases. And so caregiving is, I can't state it enough about the difficulty, the strain, the lost dreams, and the sleep that our family caregivers experience caring for their loved ones. And so I would just say that our caregivers are really the backbone of our long-term care system in New Mexico, these families and friends. But specific to Alzheimer's and dementia, we do have an office that's located in this new division where we are building out a state plan so that we can better address Alzheimer's and dementia across New Mexico. We can ramp up training for caregivers and also for formal caregivers in whether that's in the hospital system or even in our nursing homes. A lot of staff don't have the training they need to deal with complex needs around Alzheimer's and dementia. And so we're really excited to be continuing to work with the Alzheimer's Association and other caregiver associations and groups across New Mexico to focus specifically on Alzheimer's and dementia.
Oh, when you talk about care transitions, another area of support by the long-term care division, what does care transition refer to?
Well, we know that some individuals may be in a long-term care facility, whether that's for rehab purposes, perhaps, they were hospitalized and before they can return back to their home, they are receiving services and supports in a facility. Our care transitions team helps people transition back to their home and community in a safe way. Whether that's because someone was in rehab and are returning to their home, or perhaps they no longer want to live in a long-term care facility. And so our team, amazing group of individuals, make sure that there are services and supports in that home so that individual can live safely back in their home and community.
Oh, let me ask you, what is your impression of the infrastructure available as New Mexico's population continues to age for people who do need more care and need to enter a long-term care facility?
Yeah, unfortunately, I don't think we have enough beds, but I will say that a lot of those same services can be provided in the home and community. And so our goal at this department is to make sure that we enhance our home and community-based service system so that people can age in their home, in their community, because we know that that's something New Mexicans really want. We are family oriented. We know people love and thrive in their communities and want to stay there for as long as possible. So it's a balance of finding enough beds and also ramping up the home and community-based service system to address home-based care. I'm concerned, I'm sure lots of people are, that looming federal funding issues and Medicaid changes will impact the quality of life of our seniors in many of our communities, whether that's the closure of rural hospitals or long-term care facilities. So not only is New Mexico facing a growing number of older adults, we're facing other funding challenges that could really impact the quality of care for our elders.
I'm glad you brought that up. What efforts do you foresee for the next legislative session in terms of shoring up all of those important structures?
Yeah, well, I think everyone knows this governor is very committed to making sure that the New Mexicans that are most vulnerable continue to get that really critical services. But it's going to be a challenge. We're all going to have to step up. There needs to be more voices, more advocacy to really show the potential impact on our seniors across New Mexico. And so we're watching this very closely, and we're committed to ensuring those seniors continue to have services, but it's there's going to be a big impact.
Yeah. We just barely scratched the surface of caregiving, and there are some supports in the long-term division for caregivers themselves. Tell us a little bit about what needs you hope to fill.
Yeah, well, training is a big one. And so when we can provide good training and continuous support for caregivers, that makes a big difference. That means that people are more likely to stay in their home and community and not have to transition to the hospital or a long-term care facility. But also the financial assistance, critical. And so New Mexicare, I can't, again, speak highly enough of a program like this. New Mexico is really leading when it comes to recognizing the importance and the value of New Mexico caregivers who are informal, right? These are people who may be a sandwich generation where they're caring for children and a parent, older parent. These are individuals who are still in the workforce, but who are staying up late nights providing caregiving services. And so we're really deeply committed to making sure that caregiving is front and center. And New Mexicare continues to make an impact in New Mexico. We want to double the number of New Mexicare recipients over this next year and expand it to all the far corners of our state.
Tell us a little bit about the Kinship Caregiver Pilot Program, who you're hoping will participate and what you're hoping to learn.
This one is very near and dear to my heart. I worked for the department almost 20 years ago, and we were at that point recognizing how many grandparents and older adults are caring for children in our state. And really, again, a hero's job of these families that are caring for our most vulnerable young people, and they need services and supports as well. And so just a shout out to Representative Herrera and Senator Trujillo, who championed this piece of legislation last legislative session. What this will do is stand up, it's a pilot program, it'll stand up 5 programs across 5 to 7 counties in New Mexico to assign navigators to help to provide some case management and support to these families, to these older adults who are caring for their for loved ones who are young. And so we're going to be providing legal assistance and support. We're going to be providing navigation services, and we're going to be referring these families to financial assistance that we have a great group of private foundations that are stepping up to provide a stipend for each of these families.
At this point, do you know about how many families will be able to take part?
About 50 families per county, and that's 5 to 7. And we're hoping that we show great program outcomes so that this program can expand all across New Mexico after the 3-year pilot.
And are there counties in southern New Mexico that will be part of the pilot program?
So we are working on all of the county determination at this point. Our rules are posted, so I'd encourage your viewers to also go to our website and identify, you can comment. Our rules are open until July 24th, and so people can provide their input and their voice. And we will be launching services November 1st. We have to do a lot of hiring and training, but we're hoping to have those 5 to 7 counties identified in the next month or so.
All right. And earlier you mentioned the concern about especially rural hospitals being affected by potential federal cuts to funding. I'd like to talk about some of the unique challenges in New Mexico with rural communities and tribal communities alike in terms of caring for aging loved ones.
Yes, we know that culturally in New Mexico, whether those are our tribal elders or other elders, that we care deeply to make sure that our loved ones, as they age, are aging in place. And so we are working across New Mexico with our 23 tribes, pueblos, and nations. We have an Office of Indian Elder Affairs located in our department. A lot of funding goes directly to those tribes, pueblos, and nations for senior services. That includes home delivered meals, meals at senior centers, transportation, and other services. And so we work very closely supporting the needs of elders, Native elders in those communities. Rural communities, the same. For example, transportation is a huge issue. And because of that, we are working closely with our non-metro area agency on aging on a volunteer transportation program. That's just one example of the many types of services we provide in rural New Mexico, where volunteers step up to provide transportation to their neighbors, whether that's to a grocery store or to a doctor's visit. We know that without those critical volunteer and other services, our seniors would be homebound, they'd be isolated, and they'd have greater health needs.
I know that often seniors are reluctant to tell a loved one, a child, a grandchild, if something is wrong. You hear it time and time again, they're busy, I don't want to worry them. And so what advice do you have for loved ones or for neighbors in case loved ones aren't close by in terms of really knowing when it's time to reach out for help?
Yeah, well, I think it's really important. We've seen a lot of high profile cases, as well as we all probably know, where we have a neighbor in need. And we need to do a better job as neighbors and family to reach out, make those phone calls, just to check in on your loved ones, see if they need anything, because you're right, a lot of time older adults are more hesitant to ask. They don't want to put someone out, but they have growing needs. Make sure they've taken out the trash that day. Go knock on the door, bring them a meal. Sit down and just listen. Social isolation is a real issue, especially in a state like New Mexico, where a lot of our older adults live by themselves in rural areas. And so maybe that's a phone call, maybe that's a visit, but so by just visiting and having that social connection can improve the health of our older adults. So reach out to a loved one today.
And if someone is concerned by what they see or hear, is Adult Protective Services the right place to reach out for help?
Yes. So we manage the Adult Protective Services. If you see something, say something. Call our line. These adult protective services workers are amazing. They're like case managers. They come, they go do a home visit. Maybe that individual just needs access to nutritional support and some meals and food, and we can link them with the Aging Network or the local senior center in their area. There could be, bigger issues of abuse and neglect, and we want to make sure that all of New Mexico seniors are safe and can live safely in their home, and that's what APS is there for.
We know that in New Mexico, as with many other places in the country, elder abuse is a concern. Tell us a little bit about what you know about elder abuse in New Mexico and what people should be looking for in order to identify and help with a problem like that.
Yeah, I think, just like we look for with children, if there are bruises, if there are changes in behavior, more isolation, those, if anyone thinks something is amiss, that's the time to step in and ask for help and call Adult Protective Services. We see a lot of neglect as well, right? And that's where the training comes into play. We have family caregivers who just don't know how to appropriately care for a loved one with Alzheimer's or dementia who might be combative, for example. I think we also put an emphasis on prevention. And so we need to make sure we're doing a lot of caregiving training because that will prevent elder abuse and neglect.
And you have an opportunity for people who would like to serve the senior community as an ombudsman. Tell us a little bit about what it's like to become an ombudsman and what the job entails.
Thank you for bringing that up. I would start with just the value of being a volunteer in our senior communities, because it not only is it going to provide a benefit to that senior who's living in a nursing home or who needs some care companion in their house, it also gives incredible value to yourself, right? We know I talked about that social isolation, and so when you're engaged in your community, you're also supporting your own health. That being said, we have all types of volunteer opportunities, one being the Ombudsman program. The long-term care Ombudsman program, as a volunteer, you go into long-term care facilities and you make sure that those residents have quality care. You become a voice for residents who may not have a voice around issues impacting them. It could be about food. Maybe they're getting served cold food, all the way to concerns about abuse and neglect. And so we hope to have every long-term care facility with a local volunteer that gets to know those local residents and protects their rights and lifts up the quality of care.
And we've got just about a minute left for you to tell us a little bit about the upcoming 47th Annual Conference on Aging. How can people take part and what should they expect?
We're very excited. The 47th annual, it's going to be at Glorieta Camps outside of Santa Fe, New Mexico, September 23rd, 24th, and 25th. And it's free registration for those who are in our senior services system, $40 for providers and other individuals who want to join over 3 days. It's going to be a mix of really important programming, some of the things we talked about today, caregiving trainings, ways to age in a healthy way, but also outdoor events. And so we're really excited to be bringing it back. Please join us. Again, you can find that on our website.
Emily Kaltenbach is the Cabinet Secretary for the New Mexico Aging and Long-Term Services Department. Thank you so much for being with us.
Thank you, Casey.
And you can find information about everything we talked about at aging.nm.gov or by calling 800-432-2080. WILL is an inclusive community in Silver City that offers friendships, challenges the mind and body, and promotes creativity and self-expression, with workshops being taught by all sorts of professionals and creatives to teach and show the local community how to produce work and art at a high level. With more, here's KRWG Public Media Senior TV producer David Vasquez III.
In 2005, I had been talking to people for about 8 years about starting a lifelong learning institute here. There are a large number of retirees that come to Silver City, and a lifelong learning institute would be just wonderful for this community. But what we wanted to create was a grassroots organization, unlike any other lifelong learning institute in the country, that would be completely run by volunteers. So people would decide what they wanted to learn about, and we would find somebody that felt like they could facilitate the course.
You know, Will was one of the things that drew me to this community. I'd known about it for a while, having researched online some of the attributes of this community, and I moved here about 5 years ago. And it was one of the things that drew me here, and the minute I got here, I not only became a member, but I sort of dove into volunteering. It's embedded me in this community in ways that I wouldn't have expected had I not been involved. And it's been a great way to meet a lot of super interesting people, which is, to me, the treasure of this community.
The 2nd of February of 2006 to July 2006, we had gotten 40 people to join Will. By summer, we had offered 2 courses. They were both book groups, and by fall, we had 8 courses. And by then, the membership had started to climb to 100.
I think that it also has this tremendous benefit of keeping people engaged in life, rather than just sitting and watching television or whatever other sedentary activities. It keeps people active mentally. And as well as physically, because we have programs that are everything from sophisticated games to activities from pickleball and on up and down to all kinds of intellectual pursuits, from music to science to psychological behavior. So it's kind of everything across the board and something more or less for everyone.
I've spoken to a lot of Will members over the years who came to Silver City, joined Will right away, found friends, and that's the group of people that they spend time with. It has helped create the lifestyle that they wanted. So Will is all about community. I think one of the reasons we don't do all our courses on Zoom is because we believe coming together and being together in community is a cornerstone of Will. The website is www.will.community. They can also call our staff at 575-538-6835.
I fancy myself as a curious person, and that's one of the reasons I love the variety. I take courses in things that, like your bees, that I've never had any familiarity with, and then I'm all of a sudden a big fan, right? So yeah, that's the way it works. You know, to our mission, we enrich life through learning and community, and that, to me, is the essence of Will.
Thank you for joining us for Fronteras, A Changing America. You can find this episode and any you may have missed on our YouTube channel, which you can access at krwg.org. And beginning in August, we hope you'll tune in for this program at its new time, 7 p.m.